That's a good question. We found, we looked at 1,000 arches that we've done, and we found that 95% of our patients coming in for a free consult were able to do this procedure right away. But there are about 5% of the patients typically wearing dentures for so long, or they've had like their back teeth extractor for a long time, we don't have enough bone. This is where the D5 technology, when you compare us to a temporary teeth in the day center, really comes into effect. So typically what happens is if you've been wearing an upper denture, the bone goes away to where it's under your nose. So if we barely drill to place an implant, like maybe at 32nds of an inch, we're into your sinus, which is like the empty void, like when you get a cold that gets congested. So we'll do a procedure called a sinus lift, and in about an hour-and-a-half procedure, we can place enough bone that if we wait 4 months, we have plenty of bone to do the D5 procedure. This is when the magic, again, of the D5 technology comes into effect compared to a temporary teeth in the day center. So even if you're the worst case scenario where we have to do, say, a sinus lift, we would do a bone graft, wait 4 months, come back in 4 months, and depending on which D5 procedure you pick, in as little as 2 visits over 24 hours, you're totally done. Compare us again, if you go to a temporary teeth in the day center, they would do the same sinus lift. You would wait 4 months, and then if you're lucky, at 6 to 8 months, you're finally going to get real teeth. So that would almost put you at a year versus 4 months at a D5 center.